So, greetings, friends and followers. This is Nurses Talking, and I am Dale Barzi. As always, if you like what you see and hear, subscribe, leave us a comment, let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. Today, I have the very great pleasure of welcoming Shelby Williams out of Georgia, USA. Shelby is a nurse consultant, she's a healthcare strategist, and she's the founder of SEW Nursing LLC. She'll tell us more about that. She's also the visionary behind Nursing Shindig and Networking Meet and Mingle, which is a professional networking platform designed to connect, empower, and celebrate healthcare professionals across multiple states. And she says she's passionate about advancing healthcare through education, advocacy, and interdisciplinary collaboration. So, welcome, 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 Shelby.
Thank you. Thank you so much. So
First thing I always want to know, though, is why people are nurses. So, who or what inspired you to choose nursing as a career?
I can be honest and say I've always had the heart to help people. And I believe that that came from being young and in church. I have a
Mm,
very strong church background, Baptist in New York, where there were deacon and deaconesses. And I just fell into being one of the youth that was always up underneath the deaconess. And whatever they needed, I was able to help. And I truly
mhm,
believe that that helped shaped being the nurse that I am today. Along
mhm.
with my mom in the household. My mom went from CNA to LPN to RN. And so that example of always giving the hand when it was needed has been provided to me my entire life.
Awesome, awesome. So, nurtured by church family, the
Mm.
path modeled by mom with
Hmm.
determination and, focus. You followed through. What challenged you?
To keep moving forward, to realize that there was more at the end of it all is truly what kept me going. And definitely faith and foundation, knowing that it is just a little while longer, but certainly times of wanting to give up, especially during RN school. CNA and LPN was good.
Uh-huh.
RN almost took me out. RN almost took me out. And it wasn't good that I waited so long to go back. I got comfortable in LPN.
Yeah.
RN, I'm like, they don't do any of this stuff for real. And but that's not the answer on the test.
I can get that, I can get that. What kind of areas did you work from, Shelby?
Always been in senior care in the nursing home, long term facilities. For my time when I was in Connecticut, I did a lot of administration. I got up to being in administration in behavioral health and developmental disabilities. And since now being back in Georgia, I've learned the art of why people all come to the South for senior care. A lot of assisted living is here, where I have learned that nursing and senior care living is like being a landlord,
Mm-hmm,
which really
mm-hmm,
helped birth so nursing.
mm-hmm, mm-hmm,
Hmm.
mm-hmm. All
So
right.
always with the elderly.
So you were so nice, and you just mentioned it. So, and you've always been in post-acute care and long-term senior care, so to speak. More than 16
Yes,
years
ma'am.
experience across different settings. You talk about behavioral health and this kind of thing. So what moments, what experiences helped you to see that there was a gap in the senior care um traditional model?
So quite honestly, it was being here in Georgia and getting into senior care and recognizing that there are so many different facilities that market providing care, providing exceptional care. But that care is not in relation to healthcare. That care is in relation to the best way I can describe it. When I learned, when I very first came into senior care living, assisted living, it felt like I was on a cruise all the time. That care was in relation to you don't have to worry about separate bills. You don't have to worry about your meals. You don't have to worry about finding entertainment. All of those things are at your fingertips. But when it comes to I fell or I have a skin tear or mom is declining and we need to get her some more assistance. Everything, unfortunately, and it's not to make it then be a bad thing because it is not a bad thing. It's just identifying the differences that all of those things have a cost to it.
Yeah.
And when me, for my nursing, I didn't know about the cost. I'm in nursing home right now. I still don't know how much it costs a day because that's not my job. My job is to, if there's a situation, I'm providing assistance. If someone needs assistance going to the bathroom, someone needs assistance even with feeding, medication delivery, changes in conditions, those we can't hold space for both. How much does this cost for me to come in there and help you? No, you just have to
Yeah.
go and help.
Yeah.
Um, so that's what got me to that space. But what could I learn from it? And those were the things that I learned from it. People are going to go and live in those facilities, and they're going to need somebody like Soul Nursing to come in to be able to help with what the facility cannot.
Uh-huh. 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 Exactly. Exactly. Huge gap. Huge gap.
Huge gap.
Yeah. So also, and in reading about you, you talk about use the term concierge nursing. And that's a term that's kind of new to many people. So how would you explain that to someone?
I use the cruise and a hotel, right? The hotel, when you go into a hotel and you need anything, concierge is able to take care of it for you. And where do they take care of it at? Where you
Where
are.
you are.
You know, so you need some kind of assistance. I'm able to deliver that to you at your doorstep. And just by chance, you're not at home, but you're somewhere else, and maybe or someone else is not home. We're able to provide that care for you.
Some awesome, awesome, awesome. Because I think that's a term that, is when it comes to nursing, many people are unfamiliar with and have a little difficulty. What do they mean? You know?
Mhm.
Yeah.
Yes.
So there's a question that I really want to know from nurses, and I typically ask it of every nurse because we have a lot to say about us as nursing as and the way we work. We talk about burnout, all these kinds of things. So what I want to know from you is, if you could change one thing about nursing, what would it be?
The time and dedication and training up the nurse and the role, like and the hands-on experience. Because we
Mm,
go to school, we know that school is going to give us oh so much. Um, True experience comes from hands-on, being in the midst of it. But then on the flip side, being in the midst of it, especially right now, you have a 2 day orientation. One of those days was in front of a computer watching videos because
yeah.
no one has the time to talk to you anymore. And then you go onto the floor. And because they're so short, they say that you're orienting. However, you also have a case, you also have an assignment.
Hmm.
Um, and there's no space for it, so we're losing people, we're losing patients, we're losing is all these things that we're losing because there's no time to commit to ensuring that the training has been there, the development has been there, because we're just expecting microwave outcomes, right? We want the microwave out. Don't beep 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 beep, put them in.
Yes.
If we could recognize that, yes, it might take a bit, but if we pour into the time, on the top part, we won't have to worry about the revolving part because now this person is stable.
Yes. 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 How are we gonna fix that?
With Jesus. That's my new answer for everything.
Absolutely. Absolutely. But talking about that though, because you've been in this 16 more than 16 years. I've been in it a lot longer. What I know for sure is that what we have in common is that we have over the our periods of time, we have seen some changes.
Oh, yes.
When you look ahead, let's say 5, 10 years, what do you think you see? What does it look like for you?
I see way more AI. I see way more just technology and less people involvement. Um, there's like right now, there's apps available for a nurse themselves. You could just download a nurse, right? The apps, one thing I do remember back in the day, at least 10 years prior, we could go to WebMD and we can click on the body part to say what's bothering me, and then they would give you the list of things and they would make
Yes.
sure to say, we're not the doctor, go to your doctor.
Go to your,
Um,
yes.
you know, but AI says this doesn't consider, this is not a doctor's order, please, but it's very, very small at the bottom. Why?
Mhm.
No, they don't go to the doctor until there's an emergency. Sometimes they go too late,
Too late. Yeah.
Um, I just see less people engagement. I see less learning. I see less application because we're getting to the place where everyone says I can just do it myself. I can just take care of it myself. When I was younger, I never forget one of my younger, she's a little bit younger than me. She had gotten like a boil on her leg, almost like from ingrown hair. And she had decided to burn like the top of a razor so that she can open it herself, right? That was years ago. And that was just the boil. I think that people are now giving other people trachs in the middle of an emergency because they've seen it on 911 or they very quickly looked online to see how do I do this? So if they're doing that, what are we going to do?
Yeah. 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 Sometimes it's, I honestly vacillate between what I think I see over the next couple of years. Sometimes it's reassuring, sometimes it's scary, sometimes it's like, oh my, what? I feel like sometimes in the middle of a whirlpool.
Yes,
You, but you stress though, one of the things that you talk that I see that you talk about is providing caregiver education and training, right?
yes.
And so what I want to ask you, as you just talked about people, looking for stuff online, but really, what are some simple, concrete things that people, families, caregivers can do that make a big difference in caring, particularly for their senior people?
Preventative, preventative. Taking the initiative to start before something happens, right? So at home, especially for people in their own home, have we done an assessment in the house to look for things that's going to increase the fall risk? You know, um, especially our older people. Grandmas and aunties want rugs on top of rugs. I still don't know about that yet. I'm not in that category. Why do you need a rug on top of a rug? But that's not safe. So does this rug move? Different things like that. Um, no, I just had a perfect example just the other night. Something as simple as is it's a dresser. It has the 5 shelves. Grandma's trying to stay as independent as possible, but she can't reach the bottom
The
shelf
bottom
without
shelf.
tipping over. So why don't we make sure now to bring it up higher?
Hmm.
Taking the time to just say, okay, what would this look like? Instead of now we have to be reactive. She was trying to get the socks out the bottom shelf and the chair tipped over. Now she has a closed head injury, and now things have
Yeah.
happened because we didn't take the steps to prepare. Um, Cleanliness, hands and just hygiene, all those simple things that we've learned at school. And quite honestly, they don't like to talk about it, but the things that we would have done with our youth as we're getting older, we have to make sure that we re-implement those things, keep it at basic ABCs, so then we are trying to stay ahead of it.
And you just talked about basic, keeping things simple and basic ABCs. One thing being an older person myself, let's start there. I think that one thing I know about older people is that we have this tendency to be resistive to stuff. Um,
Mm,
we want we don't particularly want people to tell us what to do. That can be hard.
mhm. Yes.
That can be hard for people in the home, particularly if you've grown up with, your grandmother, whatever, all of a sudden, or maybe not all of a sudden, but trying to reverse the role a little bit and be the caregiver and being the one to say, listen, you really need to not bend down.
Right.
Sometimes may not be well received, may not be maybe a little difficult,
At
but as you
all.
said, prevention is key.
Hmm. I tell you, it's all about the delivery. I have had a family, and it's so very interesting. I love them so much. The family dynamics you have all the time, polar, right? Night and day. And then somebody might be in between when there's more than two children. But to see the night and day, that oil and water situation,
Yeah.
very much want the best for their loved one, right? And they want to say, Mama, don't bend over. And then the other one is saying, don't talk to Mama like that. If Mama want to bend over, Mama can bend over. And so then somebody like me in between, hey, did we talk to Mama and see what Mama wants to do? Like, Mama's right here. She's right here, and
Yeah.
we can include her in the decision making because she's here. You know,
Yes. Yes.
to God be the glory. There could be a day where she might need you all to make the decision for her, but Mama's right here, and Mama
No.
is Mama. Okay, let Mama say that. You know that delivery is as big is bigger than the word itself. You know,
Yes,
the
indeed.
delivery is greater than direction. I'll say delivery is greater than direction.
And that's a good one. That's a good one. I think I have to remember that one. It really is. This is a home, but we talked about prevention, but institutional long-term care now. Uh, if there is one thing you wish that every nurse understood about caring for adults, what would it be? Older adults, aging adults,
Time. You cannot
time,
rush it.
time.
Time and time in whatever process that you're in. If it's medications, if it's ADL care, if it's feeding. Um, I'm very grateful for what I am doing these days, where I have been able to be a part of all three of those things. And even when coming from the feeding standpoint, going back, it's 2026 now, right?
Uh-huh.
20 years ago, I became a CNA and immediately went back to when you're helping someone eat, you sit down, you don't
Yes.
stand.
Yes.
You you don't even wipe their mouth too much because especially for someone you're feeding, you make them think that they're done and that they won't
And
continue
the
to
one,
eat,
yeah. Mhm.
making sure their head is up. You have to have time. And I know that, and I say that, and I don't, and I because I'm even having to learn my delivery and direction. I say that recognizing that it's such a fast pace, even in the long term. We know
Yes.
that's the case in the hospital, but in the
Hmm.
long term, you have one CNA to maybe 11, 12
11,
people, right?
yeah.
They would say, I don't have time to sit and do all of that. And I say, you do, but you're not by yourself. This is at mealtime. This is where people need to come out the offices and
Yeah.
be a part of it. Because at the
Hmm.
nursing home, you always stress that we're family oriented, we're
Yeah.
together. Well, it doesn't matter who, if there's no head, there is no tail. If the director of nursing is a director of nursing, what type of director of nursing cannot go out and assist with feeding? Or if someone has to go to the bathroom, it has to be time. It has to be time. That's my number one thing I would stress, time. And you know what? As a CNA, I used to get in trouble for taking time.
Mm.
I used to get in trouble.
See
In
that?
New York, I say, well, I'm sorry. It's her shower day. I have to clip her toenails too, you know. I had no urgency. And they would talk about me like a dog. And it's okay because I'm still barking today. And I'm still doing and taking time like
Take
I
time.
did back in 2005.
Yeah. Yeah.
Because it's needed. It's needed.
Yeah.
We're gonna want somebody to take time with us one
Yeah.
day. You
Yeah.
know,
Yeah.
you're rushing me and pushing me, rushing. I'm gonna fall. I'm gonna get hurt. You're gonna have me trying to swallow this food. I'm gonna choke. And then what?
And
Then what's
then
gonna
what?
be on the care plan?
I know, I know, I know, I know. Sometimes we treat people like they're on a conveyor belt, you know.
Yes.
I
Hmm.
get that. I get why, but I get that this is not the way. This is not the way. This is not the way. So,
Hmm.
couple of things. What advice? So you first of all, you had the model in your mom.
Hmm.
And then not only did you have the model, you walked the walk in that you climbed the ladder. You started with the CNA and moved that way. And so you had the experience of all the levels coming through. What
Yes.
advice then, based on all of that, what advice would you give somebody who wants to be a nurse?
So honestly, I have said for people, especially for the CNAs, I get a lot of time questions from the CNA, and they
Mhm.
say, "Oh, should I go for my LPN because the LPN is a shorter program, or should I just go straight for my RN?" During that time, a lot of time, my answer was just go straight for your RN. Just go straight for your RN. Don't do it. And that's because I had got comfortable. I went and got my LPN. I went to school. It was a 10-month program. I got
Mhm.
done in August of 2007 or 8 to 9, 8, 2007. I waited a whole year because I won't say unfortunately, but the LPN program that I went to helped lower income people sometimes or lower family where you was able to get the
Mhm.
assistance. I
Mhm.
didn't get
Mhm.
that assistance. They even paid for them to take the test. I didn't get that.
Mhm.
So when I went to sign up for the test, I wanted to make sure I was really going to pass it, right? So I waited a whole year, still doing the CNA.
Still
Then
doing this, yeah.
when I finally went in October and I got my LPN, then it wasn't until 2019 when I went for my RN. I had
Mm.
it was too long. And that's why I kept saying, just go straight for your RN. Just go straight for your RN. And quite honestly, as I'm answering it, I would still say that today because as the LPN and being in the field, you are going to learn a way and you're going to do a certain way. And it doesn't mean that it's right.
Mm.
Quite honestly,
Mhm.
it doesn't mean that it's wrong sometimes either. But if you skip out the in between and go straight for the RN, especially if you're able to go to the 4 year. If you go to the 2 year, it's okay. I went to the 2 year. It's okay. I guess I would finalize and say, whatever you do, just don't stop. If you go from CNA to LPN, okay, that's good. But do not let a semester go past that you haven't gotten into the RN. Do not allow yourself the time to learn the tricks and the trade outside of the books, because when
Mhm.
it comes testing time, they're going to be asking you based on the book. And that is why I would encourage people to do it like that. Just don't have a space in between and do not get comfortable.
Okay. 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 Another question. We talking a lot these days.
Yes,
I mean,
ma'am.
I cannot look anywhere in any nursing forum, on LinkedIn or nurse.org, anything, and not see something about a nurse what is the word I want to maybe dissatisfaction, burnout, all of this kind of thing. A lot
Mm,
of this, I think, yes, yes, a lot of it is systemic. I get that. But I'm a believer in doing, controlling what I can control. So a lot of it, I think, comes also from a lack of self-care based on, as you said, let us say lack of time. What does self-care mean to you, Shelby? And what do you do to take care of you?
you know, we're being
That's why I
honest,
asked
right?
you.
um, so I'm still learning that. I am still learning that.
So,
Um, I can answer better what I like to do for fun, and that's karaoke.
Okay.
What I would say about self-care, the best thing I could say about self-care is that the easy answer is, oh, I like to go and get a massage and get my nails done. And I would say I do like to get my eyelashes done. But getting the grace that God has given me and getting a little bit older, just a little bit. My self care that I do want to make sure that I'm taking for myself and also recommending is that the same preventative measures that we as nurses incorporate in the patients that we take care of, that we do it for ourselves. That if we can say at this age, you're supposed to go and get the colonoscopy, at this age, you're supposed to go and get the mammogram, that dare you not talk about it and not be about it. That's the self care for my thought right now.
Okay. 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 Awesome. I can see that. I can see that because you're right, you know. There's a lot of things we talk about that we don't do. And you were even talking about it at, you know, benchmarks here. You talk about the colonoscopy and the mammogram and stuff like that. But that also occurs on a daily basis,
Yes.
as we work. Because one of the things I talk about all the time is that, you know, sometimes we take it as a badge of honor that we didn't have a lunch break or we didn't get to go to the bathroom. You know,
No.
wow, pat yourself on the shoulder. But that is not something that you would have accepted for your patient.
Correct.
If at the end of the day you couldn't say that this person had past urine, had a bowel movement or anything, you'd start putting all kinds of things in place. And yet we accept it
Absolutely.
for ourselves. That for me is one of the big things of self-care is that we've got to stop this accepting nonsense for ourselves.
Correct.
Apart from anything else that we do and like to do. So Shelby, thank you very, very much for being here.
Oh,
And maybe one day we'll talk
yeah,
again. But
thank you.
thank you so much.
You're very welcome. I hope to maybe when you come to Georgia, we can grab coffee and tea.
I hope so. All right. Take care, Shelby.
Okay.